I think I know this lady.
Yes, so she has knee pain.
Mondays are always busy for a GP. At his North London practice, Dr. Shahid Dadaboy will have 25 consultations today, and that's without the hours of paperwork. Some patients have waited through the weekend to get his help. He's the only one on duty.
It's been like this since the system started opening up again. We were under intense pressure during COVID. Unfortunately, on top of that, people have come back with a vengeance, with even more expectations for things that even we weren't able to provide even before COVID. We've also had a tsunami of work come from hospital medicine. When I first started in 1998, we would have quite a mixed caseload where there would be a few what you might call easy ones, like a medical certificate or something, or just a request for a repeat prescription. Now the problem is it's all wall-to-wall complexity.
I hope you don't mind me saying, but you sound like you're pretty exhausted at the moment.
I am. We're not afraid of hard work. The problem is now we're down to the marrow in the health service. We're beyond the bone, we're into the marrow, and there just isn't enough time to give.
And it's not just a primary care issue. A survey of UK doctors across the health service found almost half say their mental health is worse than during the pandemic. One of the issues is staff shortages, which the government says it's addressing with its recently published workforce plan. NHS England says it invests in staff wellbeing through specialised hubs, but there are concerns around the funding of that.
I hope no one is underestimating the problem.
As Chief Medical Officer for the Black Country's Health Board in the Midlands, Dr. Anata Dave's organisation has over 40,000 staff who she says haven't been able to recover since COVID-19.
I think when the pandemic hit us in early 2020, people sort of gathered themselves together and they put everything they had in it, thinking that they would be able to deal with it for a while and then the service and the country would recover. But that's not happened. We are losing people much faster than we can replace them. And these are people who wouldn't have thought so a couple of years ago. They thought that they would be working till they were well into their retirement age and that they wanted to contribute. But we are seeing the effects of the burnout and the exhaustion.
Doctor surgery, can I help you?
The phone lines don't stop at Dr. Dadaboy's surgery, and like many doctors across the country, neither does he. But how long can they carry on giving, and what's the trade-off?
Do you think that you're in a position to give good care to your patients?
No, and that in simple terms, and that probably is what causes me the biggest stress of all.
Dr. Shahid Dadaboy ending that report by Aisha Tull. Well, earlier I spoke to Dr. Joe Daniels, a clinical psychologist who has studied the impact of pressures on NHS staff. I began by asking whether the strain on health workers is a hangover from the COVID pandemic.
I think the pandemic served to shine a spotlight on problems that were already there. So the NHS has been chronically underfunded for many years. We've had a workforce retention crisis for at least a decade, certainly in emergency care. So really this has placed pressure on an already overstretched system, and there's been little investment, which I think is really the key problem here. And staff are now coming to work, in terms of presenteeism, there's high rates of burnout, but actually there's more pressure on the system, so they're expected to step up further when they're already giving 100% and working as hard as they can in the face of staff shortages. 3/4
of doctors surveyed said they didn't feel the government was doing enough to help healthcare workers. But what more can the government do?
Wellbeing services have been withdrawn, which I think is an important point. Although some of them have been received some further funding, it's insufficient. So I think dealing with that side of things. But more importantly, I think it's key that staff are given the provision that they need to deliver their services. We know from the research that people want to do a good job in healthcare, but actually providing them with inadequate resources, such as half the beds, for example, that they actually need, puts them in a huge amount of stress and pressure.
I mean, obviously, the government would point to the fact that they are looking at increasing the number of beds, they're looking at increasing the number of ambulances. They're also looking at spending an extra £2 million on these help support mental health wellbeing hubs for staff. I mean, that will help, won't it?
That will help, but unfortunately it's not sufficient. From what we know from the data, that actually the wellbeing hubs are going to require a lot more money than that to really be up and running. And we also understand from the data that 5,000 beds really isn't sufficient, and it's wonderful that we have more ambulances, but we also need staff to staff those ambulances as well. So it's really like rearranging deck chairs on the Titanic, with investment into some areas and not others.
If the doctor themselves is not feeling well, what is the potential impact on the patient?
We do know that if people are not well, then they don't do as good a job. But I think the focus here should be on the pressure that's being placed on them. So, for example, the gamification, really, that actually hospitals and trusts can receive more funding if they hit the higher target. That's putting, again, pressure on a system where people are already working extremely hard and struggling to maintain their workload.
Junior doctors will stage their 5th strike in a few weeks' time. They're also reballoting to extend their mandate. I mean, those strikes don't help the workforce practically, do they?
I think it's important to think about the reasons behind the workforce strikes. I think people are struggling. I can't stress enough this is an overstretched system and is chronically underfunded. It has been for many, many years. We do need to look at where the funding is positioned to support them to do that. There are a lot of people who are feeling undervalued, and we need to consider why that might be. And perhaps it's considering the pressure and crowding and the under-resourced service that they're working in.
And finally, perhaps one of the most alarming figures in the survey was that more than 40% say they are reconsidering their career because of the stress that they feel. I mean, how can the NHS stop these doctors from leaving?
Again, I'll just go back to that same point that actually beds is a really key issue. If there are not enough beds, then people cannot look after people properly. And thinking about the support that's available for doctors, I think, is key. But not just doctors, the whole, in every A&E, for example, there's a huge amount of staff there making this work. So thinking about it from a resource point of view is essential. Thinking about it from a valuing point of view, are we valuing our staff sufficiently? And also thinking about the stress and pressure that our workforce has been under since the pandemic, without just loading further pressure and lack of resources.
Dr. Jo Daniels, thanks very much for talking to us.
Thank you.